Hello and welcome. My name is Wede Joy Johnson, and it's a pleasure to be here today on behalf of Liberia Healthline and Tiger Lily Foundation. These two organizations have come together to bring about awareness about breast cancer in Liberia. We have some phenomenal women on this panel today who have joined the fight against breast cancer. We also have a breast cancer survivor here to tell her story. We hope to give you information, give you hope, and inspire you to tell a friend that breast cancer does not have to be a life sentence. And with early treatment, breast cancer definitely doesn't have to be a death sentence. So today I would first like to introduce our patient survivor, Florence. Before we introduce her as a breast cancer survivor, I would like to get to know her as a person. So Florence, why don't you tell us a little bit about yourself?
My name is Florence. I live well. I have one son. I'm a very mother. And I'm well known in my church, well known in my community.
Florence, cancer is a big diagnosis. When you were first diagnosed, what did you know about breast cancer?
When my breast started to hurt, to grow that in it, and I started to feel the nuts, but not feeling it, but the nuts were in the breast. But also back, it was, it made rising, and it was. And I started feeling the pain. So I told my son, I said, Papa, my breast hurting. He said, Mama, you're not sick yet. Fuck it. You have to get out there and tell somebody. So I went and told one of my church members, which is Fafula and Masakwe. And she helped me with $100 to go to the hospital. And I went with tension. And then they said that I should go to another hospital. You don't have. And I told her for me. So I left and I went to Smoke Alley in West Spring. From there, she talked to me. She said, you need to go to the big hospital. So I went, I told my friend, and she helped me with another $50. Took me $50. I went to JFK.
In all of this, did you think that it would be breast cancer? What did you think?
I would not think.
Did you know anything about breast cancer before this? And when they finally told you what it was, how did you feel?
I almost went off.
You almost passed out.
Yeah. I alone went. And walked carry my son. And they told me I felt I should need it extra way. But later, I think back to myself, I said, if I go, we'll take care of my son and my brother, 2 children.
Did you know any other women who had breast cancer before your diagnosis? It seemed like you went to 3 different facilities before you were able to get the help that you needed. Did you even know how or where to ask for help? Or you were just being routed from one place to the other? You didn't know?
And the voice spoke to me that I should go to a lady. I went. And when I got there, there was one, she one guy, and the school in Lopita. I'm forgetting her name. I went, and she helped me with 300. 300, I helped me after my treatment. Yeah.
Okay. Your son is here today. How soon after you were diagnosed did you tell him? Your only child.
It was March. Yeah, in March, but it did. I know the date. Yeah. Then on your birthday, which is April 30th, I told him, and he said, Mama, don't send there. Go to something. I went here, talking to people. People that got money, I went there to get.
Écoute bon.
Yes.
Yes. Thank God for your son. Yeah. So now we're also joined by Liberian breast oncologist Dr. Dede Superwood. Please introduce yourself and tell us a little bit about your oncology background.
So thank you for having me here today. My name is Dr. Tere Supu. I'm actually a medical oncologist, not breast, yeah, because I treat adult cancers with medications. So for me, my journey with cancer goes far back as 2001 when my mother was diagnosed with breast cancer at the age of 40 years, 41 years. So that was when I got exposed to the issue of breast cancer for the first time. And for 8 years, my mother struggled with this disease, and eventually she died at the age of 48 in 2009. And that was how, because at that time I was still in undergrad, and I said that if there's anything I will become, I must become a cancer doctor so that I can help other patients out and try to help save as many lives as I can. So my journey with cancer has always been personal, and it goes as far back as 2001. Yes.
Okay. Can you kind of give us like a brief synopsis of what Florence went through from diagnosis to treatment?
Okay, so Florence is, yeah, she's one of those cases that it's not supposed to get emotionally attached to the patient, but I couldn't help it. You can't help but to love her.
I know.
Yes, so Florence's case was a very unique one. I first encountered Florence in JFK. She came to me with the biopsy report. Someone had reached out to me that, hey, that I have someone who was recently diagnosed with breast cancer and really needs your help. So when I saw her in JFK for the first time and we talked about it, um, it was not good. It was not looking good because she was in a lot of pain. Like she said, the breast had formed an abscess and it had ruptured. So she was in a lot of pain. And telling someone who knows nothing about cancer that you have breast cancer, I mean, it was a difficult one for her and for me, because how do I tell this lady that she has breast cancer, without her words shattering. But eventually, I told her that she needed to start her treatment as soon as possible. And at that time, for her, it was difficult because she didn't have the funds. Yeah. Yes. So when I met her for the first time, we discussed the treatment plan and everything. When it was time for the treatment, we couldn't start because she didn't have the money to start the treatment, because the treatment is so expensive. Patients do not have insurance, so they have to pay out of pocket for everything. Then fortunately, Dr. Nicole Hoover reached out to me that there was this program that was about to start for breast and cervical cancer patients. So I told Florence, I said, hey, listen, there's this project. I know you live Carla, and the project is supposed to be, in West Point, Newtown, sorry. But there's nothing like trying. So
Yes.
I asked them for where they were going to do the screening, and then I said, I tried to get her involved to go there for the screening. I said, go there. When they asked you, say you live in Newtown, we're going to Newtown belts. I mean, so like, if you can get enrolled. So fortunately for her, she got enrolled into the program, into the breast cervical program, like ongoing, they said that program. And then that's when I started seeing her at Wellness Partners, because based on the program, I was supposed to see these patients at Wellness.
Okay.
At Wellness Partners, I mean, the pain, it was just, Florence will come to the clinic and she will be in so much pain, she will be crying. You're sitting there, you're staring at her like, you don't even know what to do at that point. So there was this day that it was on a Saturday. I was off work. I was home. And she called me. She was in so much pain. She was crying. And she's like, Doc, you have to help me. I'm dying. And I said, okay, you know what? Let me see if I can get the surgeons to get involved. So I started making one or two calls around. I called my colleague, the surgeon. I said, Doc, we have this patient. We just have to get the breast up. it's right at this point now, it's to relieve her of the pain because I cannot do anything with the level of pain that she's experiencing. So spoke to the surgeon, and then I called the managing director for Hope for Women, her daughter.
Okay.
Yes, Frenier. And then Frenier, I tried to convince him, and somehow I succeeded. And I told Frenier, hey, please, we have this patient, she's in the program, she's in so much pain. I spoke to Dr. Kobolo, and he has agreed to do the mastectomy. But please, we need you to please admit her, give her penta or morphine or whatever strong analgesics that you can find to at least stabilize her so that she can go ahead into the surgery. Thanks a lot. Everything went well over the weekend, and she was able to have the surgery done, and that was a big step forward because the pain that she presented with was so intense. On a scale from 1 to 10, I would say that she was having 12.
Wow.
Yes. So she just couldn't do anything at that point. So fortunately, after she underwent the mastectomy, it was almost like a miracle that the pain went away and she became stable, and that was how we were able to proceed with the rest of the treatment. And there have been ups and downs with side effects of the chemo. Sometimes she'll call me dark and vomiting, dark, this is happening, and we'll talk about it on the phone, or I'll tell her, hey, go to the hospital. But overall, it has been good, and I'm glad that she's she can sit here today
Yes.
to tell her story.
So we're going to talk about common words in the beginning of the cancer treatment cycle. So let's define just a breast exam. How would you define that for the average woman in Liberia?
So breast examination has to do with checking your breast.
Please, yes, please do.
Yes, so breast examination means you're checking your titty. There are two ways you can check the breast. You can do your breast examination yourself at the end of every month when you have seen your period, or you can go to see your doctor every year for them to do the clinical breast exam. So there are two types: the self breast examination that you do yourself every month, or you're supposed to do every month, and then there's the clinical breast examination that the doctor will do for you when you come to the hospital yearly for your checkup. So breast examination has to do with just checking your breast, looking at it to see if the two sizes of the breast are the same, if there are any skin changes, looking to see if your nipples are pulled, looking like you're pulled in, or if it's out because the nipples are supposed to be pointed out. After that, look on the side, put your hands up, look for anything that does not look right, and then feel around your breast for any lump. After that, it's usually done circular motion, then you squeeze the nipples a little bit to see if there's any discharge. If you're not a breastfeeding mother, you're not supposed to have any discharge, so you squeeze the nipples a little bit. Check on your arm, and that's it. So you can either do it laying down or sitting upright or standing with your hand above your head. So yes, that is the breast examination in short.
Okay, and then a mammogram.
So a mammogram, in a simplified term, is an X-ray of the breast. Yes, that's what it is.
Okay. And then a biopsy?
So a biopsy is a test that is done where the pathologist, specialized kind of doctor, will collect a little bit of sample from the breast or from the tissue and look at the tissue under the microscope to see what kind of cells they are seeing. And then based on what they see, then they have some ink or things that they put on them to come up with more specific diagnosis. So a biopsy is where the doctor collects a sample of the tissue, whether it's breast or liver or kidney or whatever, and examine it under the microscope.
So Florence, back to you. Your biggest fear when you were diagnosed? Was it leaving your child? Yes. How old was he?
22.
So he's still a baby. Still your baby. Yeah. So now I have the pleasure to welcome and introduce former Minister of Health and owner of Hope for Women Clinic, Dr. Jala, to the panel. Dr. Jala, can you tell me or tell us how cancer treatment looked before in Liberia? Did we have options?
Okay, so you can go pre-war or post-war. So we just go post-war. because pre-war there was some existence of treatment. There was a cobalt machine, yeah, and things were done. At that time, JFK had newly opened. So during those days, there was some form of cancer treatment. But post-war, nothing was organized at that time. When I arrived in Liberia in 2007, I was at JFK working in the obstetric and gynecology or the women department. My aim was to look at women's health. And so most of the women that came to the clinic did either the cervical check or the breast check. And a lot of the women that we saw, over 60% of the women that we saw in the clinic, they were already in late stages, both cervical and breast. So in 2008, President Ellen Johnson at the time brought a team from Mount Sinai that came to work with me in the clinic. And we did a chart review from 2003 to 2008 when they arrived. And we saw a huge number of women that were exposed to cancer and that had cancer already. So what we did was we began to examine them. Those who were already late, there was nothing we could do for them. We had to explain that palliative care, you go home and your family needs to take care of you at home, it's very late. But those who were able to save, we set up the first chemo unit in JFK. We didn't have a lot of drugs because they didn't bring a lot of drugs when they came. But at least those women that had either breast or cervical cancer, we treated them in that chemo unit or using whatever drugs that we had. A lot of them, some of them died. I got a whole list of women that I saw die either from cervical or breast cancer over those years. And then after a while, JFK said in 2012, JFK said that it was very expensive keeping the chemo there. So we had to take it out of there. That's how come Hope for Women got involved.
That was my next question. So now tell me how Hope for Women has stepped into this space, like the fight against breast cancer.
So our thought was a hut. We had a chemo hut. In my yard, in the Hope for Women, we built a hut. So the women came and they sat under the hut and they received their chemo treatment in the hut style. Because I think in one of the African countries, they said it was that style. Women felt more comfortable sitting out all together and taking their treatment. And we had conversations, education, and treatment. So that's where we started from until we were able to build. And then we got the first chemo unit where patients can come. But of course, chemo treatment is very expensive. So we did a lot of volunteer payment, but after you do a lot of volunteer payment, sooner or later, you won't be able to pay for all of the full course treatment for every woman. So later on, my daughter got involved with the Zeta Project, and now the chemo is more available, working with Dr. Superwu and Dr. Kokolo. Now women can come for surgery and do the chemo, and they have the psychosocial support group, which I think is very good because now you get to talk to each other, find each other's problems. So I think we came a long way, but we're not there yet. Luckily for us, over these years, we were able to train oncologists because you needed to move on with oncologists that will help to treat the patients. We don't have that many oncology nurses, but we have sent a few. So we have a few. We have a few laboratory people that can make drugs. Now the wave is to get radiation therapy, which you need to train the people. So now we'll be sending people out sooner than later to go and train to become a radiotherapist, and then you have physicists, and then the last most important thing would be to get that radiotherapy center. So we hope as this message go out, that whoever sees the message can know that Liberia does not have a radiotherapy unit, and to save most of these women from cancer, they will need a radiotherapy unit to treat them.
I've never heard of the hut concept. I think cancer can be an isolating disease, and I just could picture women kind of supporting each other under that hut. I think that's a brilliant thing. Yes. So now we are also joined by Liberian pediatrician and internal medicine physician, Dr. Nicole Cooper. Dr. Cooper, please introduce yourself and tell us a little bit about Wellness Partners.
Thank you. My name is Dr. Nicole Cooper. I am an internal medicine, which is an adult specialist. I'm also a pediatrician, which is a child specialist. So I have 3 specialties. I'm the founder of Wellness Partners Clinic. We have multiple specialties at Wellness Partners. We also have our lab, imaging, and pharmacy at the clinic. And we also have some overnight observation capability. So Wellness Partners collaborates a lot with Hope for Women and with Dr. Superwood for the treatment of these patients. We actually use our observation room, which we converted for treatment of cancer patients, to be able to give infusions of the chemotherapy or the IV drip of the chemotherapy for the patients.
So how can we make cancer care easier for women in Liberia? I heard a lot of barriers: cost, education, and different things that have been stated. What could we do to make it easier?
That's an excellent question that I've been trying to answer for the past 3 years. We founded Wellness Partners in 2021. Every year, where they sponsor women to have these free breast x-rays to screen for breast cancer. When we started working with them, I made the recommendation that we need to do more than just test, because we offer this free testing for patients. But me, having worked also at JFK, having also worked at Redemption, I knew very well that you can give somebody the test, you can give somebody the diagnosis, but what becomes of them after you have given them that diagnosis? So I advised the group that, thank you for sponsoring the testing, but we need to go beyond that. It was actually at that time that I started speaking with Frida, and we decided that we need to go. Her organization, Zeta Phi Beta Sorority, was also doing the same screening. And the 2 of us discussed back then, and we said we need to do more than just test and tell patients bad news. Because as a doctor, I said, I cannot participate in this program where I would just be telling people bad news and then I walk away from them. I need to be able to have some power to help them through that journey after we give them that news. So I recommended then that we start also trying to help them get treatment. But again, having worked at Redemption, having worked at JFK, exactly what Florence described, this was a problem where every piece of the cancer care was at a different place. You will get your diagnosis in one place. You will go to another place to do your surgery. You will go to another place to get your medication. You go to another place to get your tablet. If you're in pain, you go to another place for pain control. And it's so difficult for somebody who is already sick. When already sick, the medication is making them tired. They've already spent so much money trying to buy the medicine. Now they're spending money moving from place to place to place. It will make the person give up.
Yes.
It will make the person give up on their treatment. And so we started having that conversation. In fact, at that time, Dr. Jala was minister, but Dr. Dang had just left the ministry. And we know that she had actually started some conversations around breast cancer. So we actually had reached to Dr. Dang to understand, okay, what was started before and what have you handed over for us to now try to continue. At that time, we started thinking about how can we make a network? How can we make a network to bring all of these pieces together? So at least if we, the doctors, know who is doing what everywhere, we can help that patient move around more easily. Instead of telling the patient, okay, go and do your breast x-ray, but the patient doesn't know where to do the breast x-ray. or go and see the surgeon. The patient doesn't know where to see the surgeon. But if one doctor or one place knows, okay, this is where you can do this is where you can do that, when they come to us, we can say, okay, your next step is at this particular place. Let us try to get you there. So how to get care in Liberia, this is exactly what we have been trying to figure out. Both Florence and Dr. Superwood and even Dr. Jala mentioned this program. From last year, 2023, we started testing this program. So we brought several of the people together, several of the different facilities together in a collaboration. Hope for Women was a big part of that. It's still a big part of that because that's where they do a lot of the surgeries and some of the chemotherapy for the cervical cancer patients as well. So we brought the different facilities together to collaborate. And we also had, the most important part probably, is the coordinating for the patients. So having the coordination for the patients to help them with transportation, to go from here to there, help them with feeding when they're taking their chemotherapy, and somebody to check on them with support groups to encourage them. We know it's difficult, we know you're in pain, but don't stop taking your treatment. It's very important. So how to get care in Liberia, we are still trying to make it simpler, trying to get Dr. Jala. I was very inspired to hear the story of the original cancer unit at JFK. I did know about the one at Hope for Women, but I didn't know the backstory from the one at JFK. But we are trying to, as much as possible, get all of that care into one place so that the same place the patient goes for their surgery is the same place they'll follow up for their treatment, for their support group, for everything in one place. And we're also working on the big part that Dr. Superwood mentioned, which is the cost of this medication. We have to find a way to make it sustainable. Right now, we don't have an insurance program in Liberia, but there are ways that we can make the drugs sustainable. If we have a certain amount to start with, those who can pay a certain amount to feed back so that more drugs can be purchased for the next patient to be able to use. So we are working on how to make it more accessible.
So my next question, a newly diagnosed patient, Florence, what would you tell her, Dr. Cooper, to alleviate her fear?
I would say there is hope and there is a path to save your life. It is important that you start now. Don't allow the fear to rob you of your life. Because if you are able to get diagnosed, that is the beginning of the pathway to saving your life. But if you get the diagnosis and you are so afraid that you say it's not true, or you run away from it and hide, it's not going to go anywhere. That is how you allow it to win. If there's a rogue in your house, you say he's not there, he will kill you. Mm-hmm. So you have to, it's very difficult, but you have to accept it quickly and start to act.